Mecklenburg County now has 142 cases. Yesterday we were at 108. North Carolina reported another triple-digit increase. Now the state is at 398, up 100 from yesterday. South Carolina is at 342, up 44 from yesterday. York County has 4 new cases. The total there is now 11. Chesterfield County has had its first case. The number of deaths has not gone up.
We are joined right now by Governor Roy Cooper. Governor, thank you for taking time this afternoon to speak with us and give us a quick update and answer some questions about where we stand with coronavirus. North Carolina today reporting a triple-digit increase of over 100 to now 398 as far as cases versus yesterday. Tell me your thoughts. Are the efforts being effective in keeping the numbers as low as we'd like them?
Well, we took aggressive action early to stop and to slow the spread of the virus. We banned large gatherings. We closed public schools. We closed bars and restaurants to dine-in service. We closed a number of businesses that cause these mass gatherings and businesses that have close personal contact. What we're trying to do is to get people to physically distance themselves from each other, because this is a highly contagious virus. We're also trying to build up our medical capacity to make sure we are ready for this surge that we know is coming. It's not surprising that we have almost half of our counties who have now seen a COVID-19 positive. And in fact, our health people say that most every county by the end of this week will see at least one positive. And what we have to do is to be ready to save lives, to be ready to have our public health system and our hospitals put into action to make sure that we take care of people, to make sure that we are ready for them, to make sure that we have enough hospital beds and ICU beds. And we're going to fight for everything we can to make sure that we keep the people of North Carolina safe and healthy and that we save lives.
Now, you mentioned, of course, that's most important, saving lives, keeping people healthy. Can you talk to me about any private partnerships or extra steps being taken to make sure that our hospital workers have those masks, that our patients are able to have the ventilators and respirators that will be needed?
You know, it's disappointing that we've not been able to get the federal assistance that we expected, both with testing material and with personal protection equipment. We know that there are shortages of this equipment not only across the country but across the world. So we have people on the market trying to buy personal protection equipment for our healthcare providers, our law enforcement, the people who are on the front line, because this virus is so contagious. I even had a call the other day where I assembled some North Carolina manufacturers who manufacture textile, and a number of them are thinking about and putting plans into place to convert their manufacturing to making masks, which have a fabric that protect people from contracting this virus. So we're working hard to make sure that our local public health officials have the equipment they need. We know that there are going to be shortages, and we're going to continue to fight to make sure that they get the equipment that they need. We're not going to be able to depend on the federal government, unfortunately. We hope that they will fill our orders that we have put in, but we have over 2,000 requests now from local governments, and we're working hard to fill those requests.
Mecklenburg County at one point was only getting 3 tests. Mecklenburg County with the largest population in the state. How was it a low number, that low, even acceptable for a county this large? And has the number increased, the number of tests being provided to Mecklenburg County, which has such a large population, to get some answers about how this is spreading?
It's unacceptable that tests were not available for this new coronavirus. We asked the federal government for supplies from the CDC to get testing materials so that the tests could be performed. We really didn't get very much at all. So we spent a lot of time to work with LabCorp to create a new way to provide testing. We turned to private labs. And in North Carolina, we have now, as a state, tested over 10,000 people while we have collected samples from 13,000 more people that are awaiting the test results. So we're making significant progress on testing, but it's unacceptable that we did not have the ability to test more people earlier, and it's been a complete failure at the federal level. We're working on it now to find the material, to work with private labs to get this testing back because we know we need it.